I have the pleasure of presenting our next presenter here today. I believe it definitely embodies all of the skills and attributes that Alan Hawke referred to there. It's the next presenter this afternoon is Wendy Hubbard, this time in her role as General Manager of the Bega Health Service. Wendy's role takes in South East Regional Hospital, Pambula ATC and Eden Community Health.
Thank you, and I just note that as the third speaker, I've been here the longest. I've been here for 18 months. So I'm the elder statesman. Look, it's just a pleasure to be here. I came here from Ballarat, from a large regional hospital in Ballarat where I served on the executive, and it was cold, and we had a lake and it dried up once, and that was the end of all of our social lives for 5 years until it rained again. And now I live on the golf course at Chura Beach and overlook the ocean, and I'm just in paradise. And occasionally I come to work. So look, it's my privilege to speak on behalf of the more than 700 hard-working and dedicated staff of South East Regional Hospital, Pambula Health Service, Community Health, who are at Bega and South East Regional as well, Pambula and at Eden. This year, the district has invested a lot in the Bega Valley in terms of not just consultants to come in and help us, but also in terms of support from our executive and from the chief executive. I'm just going to... So one of the things that we have done across a number of wards is aim to increase our efficiency, teamwork and productivity. And while there's lots of stuff in the BHI, as Andrew's mentioned, and lots of numbers, I just thought it would be worthwhile mentioning to you some of the things that we do. So we currently admit and care for over 1,000 patients every month. And most of those, of course, are to South East Regional. And Pambula has really grown and developed to be an integral part of our admitted services. And that's really exciting for Pambula, it's exciting for us. We provided over 250 surgical procedures each month, mostly in the areas of general surgery and orthopaedics. Typical day in our emergency department has about 50 people who present, and in summer around 70. And usually they present all at the same time, which does tend to impact not only on our ETP performance that Andrew was just talking to, but also it's a challenge for patients who have to wait and know that there are people who are of higher acuity. We do provide more than 8,000 occasions of service every month in our community through our community health and outpatients areas. So that's just a snapshot of a little bit of what happens in the Bega Valley every month. This year we have seen the refurbishment of the Pambula Urgent Care Centre. I'm hoping things are popping up, thank you. And in July we received an additional $1 million, as Andrew's mentioned, to recarpet. For those of you who know Pambula, they'll be very excited to hear that we're recarpeting and refurb, repaint the rest of the hospital to bring it up to scratch, which is fantastic. We also saw the opening of the first stage of the carers accommodation, and forgive me if I pronounce it incorrectly, the Baraja House. And that's thanks to the incredible work of our local service clubs who attracted funding, and of course to Lynn Corbin, who received the Queen's Birthday Honours for her work in that space. We're just about to finish stage 2 of the carers accommodation, and that will give us 12 motel-style units, and they're used very heavily to support our patients who have their carers and relatives come and stay in that facility. It's a really wonderful thing. Andrew mentioned that in March of this year we opened the subacute and rehabilitation unit, Asaru, and that's a 10-bed unit that provides specialist rehab and geriatric care to our patients so that they can return home independently. So all of these developments make us a better health service, and there are many other new and exciting developments, and I could go on for a very long time, but I have promised Andrew that I will not, as well as not sing. And we continue, though, to strive to provide the right care to our patients in the right time, at the right place. Thank you very much.
Thank you, Wendy.